Hi, my name is Julie Peterson. I'm a psychiatric nurse practitioner student at Purdue University Global. The patient that I would like to talk to you about tonight was one that I saw in the outpatient clinical setting today. She was a psychiatric evaluation and she was a telemed on top of that. So this was the first time that my preceptor had actually seen her, so it was really interesting to just kind of gather the information and go along with it as my preceptor was taking it into. So her diagnosis that we came up with, kind of preliminary based upon a lot of the things that she said, was a borderline personality disorder and then bipolar 1 disorder. She has a known history of PTSD and major depressive disorder with agoraphobia. Um, the reason that we came up with this was because of the um, ongoing mental health issues that she's had. She said she was struggling. She hasn't slept in 2 days. And she was walking around the room, just kind of pacing, walking back and forth. Um, she's a survivor of childhood trauma and abuse, and she saw her best friend commit suicide in front of her by shooting herself. She admits to over 40 times of attempted suicide. And a couple of weeks ago, she OD'd on propranolol. Before that, it was an OD attempt on 250 tablets of Benadryl. She says she has gunshot flashbacks from the gunshot explosion and also from the EMS when they used the walkie-talkies that when they were there. So she, during the interview, it actually went on longer than what the Zoom allowed, which was the 45 minutes. So we did the rest of it by phone, which was really just kind of going over the treatment and follow up and making sure she was okay with it. So although I've seen this diagnosis before, I hadn't seen it just kind of pan out like this. So I thought it was really interesting. She had been trying to, get help, and every medication that she's had has failed. None of the medications have worked for her at all. She had an excuse for every single one of them that it caused her some odd side effect, or, she says it just didn't work. So to help me understand this, just, kind of lets you know that the patient, always seems to be seeking to get better, in her case, and doesn't really seem to find any relief in any of the treatment or the therapy that she's had. My preceptor did tell her that, therapy was the actual treatment for this, and then she got upset and she's like, I have PTSD, and she just really wanted the diagnosis of PTSD, although she probably, needed the diagnosis of PTSD. It was kind of really strange how she kind of was afraid that my preceptor was going to take it away from her, like it was something that you could just do. And then she admitted to having, strained relationships with everybody. She lives with her mom, who she's the caretaker for. And supposedly she had a stroke the night before and was in the hospital. And then also so the EMS came, and so there was a long conversation about that. And then also there was some odd conversation about some inappropriate pictures her daughter was asking her to send to her, which was just really strange. I don't know why she, she just mentioned just so many things in this conversation, but I guess that's part of the borderline that, you would see. Didn't see any cutting or anything on herself, since it was a video appointment. We weren't really able to do a physical assessment on her. So, we'll see what happens. She did say that her daughter has a diagnosis of borderline personality disorder, and she was wondering if that might be her, which was odd because my preceptor had passed me a note about 5 minutes into the discussion saying, borderline personality and then bipolar. So she kind of diagnosed her right off the bat, but the patient just still seemed to be, seeking attention during the interview. So the relationship went well, but of course, it's kind of um, uh, difficult to talk to someone, about borderline personality. They seem to be seeking something else, something that they'll probably never find. And then the strengths and limitations that I had with the patient um, were just kind of lack of knowledge, lack of seeing this before kind of fold out. And the female being 44 years old was kind of strange that she hadn't come across this before. So she's going through therapy now. So the only way that you can get into the clinic that I precept at is you have to see a therapist twice. And then your next appointment, your third appointment with the clinic, can be a psychiatric evaluation where medications can be discussed rather than just talk therapy. Um, so insight and learning that I gained from it was just kind of knowing perhaps how to talk to a patient a little bit better. Just seeing how my preceptor kind of tried to derail her. She says, well, we're not taking away from this diagnosis if we give you this other diagnosis. We'll still, keep you with those diagnoses. And that seemed to relieve her. At the end of the conversation, she had gone on to complain about how worthless her sister is and that she wasn't helping her be a caregiver for her mother. And so my preceptor had said, well, I'm glad that you're physically able to take care of her. So I don't know if that kind of upset the patient or not, because her tone changed a little bit. I don't know if she was kind of thinking about it as like, yes, I'm lucky that I am able to take care of her, and that my mother actually has someone to take care of her, because that was one of her main things, is that she didn't want her to go to a nursing home. So, and then how I would use this in my upcoming um, interactions with patients in future practice, just kind of gaining the knowledge and the experience and being able to talk to someone and, maybe looking at their strengths more than their weaknesses, because there was just a lot of negative points of view that were in that conversation. So I think that would be a good thing to do, is to look at the strengths of a patient. So if you have any questions, comments, or concerns, please feel free to email me or give me a call. Thank you. Bye-bye.